Stories of innovation and success from the vibrant communities of rural Nova Scotia. This is Ignited.
Hi there. Welcome to Ignited the podcast, where we celebrate innovation and rural success. I'm Wade Cleveland with the Rural Innovation Hub Ignite. We help build vibrant economies in rural Nova Scotia by bringing together startups and industry, youth, and community. I'm kicking off a small series on health innovators. I'm at the Nova Scotia Health Innovation Hub in Halifax, beautiful place here, talking with the innovator in residence, Dr. Karen Cross of MIMOSA Diagnostics. Now, the MIMOSA Pro is an amazing innovation, a handheld, portable imaging device that provides state-of-the-art imaging accurately and non-invasively, enabling doctors anywhere to find wounded, damaged tissue and vascular issues. And the implications for rural areas, and indeed anywhere not close to medical centers, is staggering. Dr. Cross is an award-winning scientist, a plastic and reconstructive surgeon, and an entrepreneur. Tell us about MIMOSA. What is it?
Yeah, so MIMOSA is a medical device paired with a web portal. So what does that mean? Well, a medical device means it has to be cleared by a regulatory body, so Health Canada or FDA. This medical device looks below the surface of the skin, and it can tell if your skin or the perfusion to your skin, the circulation to your skin is healthy or not. It gives clinicians the idea of like, oh, I can see something that's not visible to the naked eye. So this is not something as a diabetic, for example, that you would be able to see right away, but the technology can see it before it comes to the surface. The analogy I'll give is it's like maybe buying an apple in the supermarket. You think it has a red, shiny surface, it looks nice and healthy, and you buy it, but you bite into it and the core is rotten. What MIMOSA is able to do is to see below that top layer into where the meat or the fruit is located. Not only that, it's not a traditional device. So most devices as we see them in the healthcare system would live in a shelf. We built this so it's so small it fits into the palm of your hand. You can bring it to the patient so the patient doesn't have to come to the technology. Much like you'd have an x-ray or a CT scan, this is so small the nurse or doctor can bring it to you. And that's really important. The second thing is all of the images upload into a website or a web portal. It's all privacy protected, but it means that the doctor or nurse can log in from wherever they are to look at your images. A very important part of the MIMOSA journey is enabling patients to age well in their own neighborhoods. So why do you have to drive 4 hours to see a specialist, for example? Let's bring the specialist to you. And that's how the company got started. And really, it's a big mission and vision for myself as well as the company is to try to improve access to care in our rural and remote places.
And that's exactly it for me. This excites me because as a diabetic who is dealing with it on a hereditary basis, if you will. I mean, I saw my grandfather lose his legs and be in a wheelchair because of a lack of circulation. I'm afraid of seeing the same thing for myself. And this, A, is non-intrusive, and B, gives you access very, very quickly to that information. You know the problems before they're actually kind of manifesting themselves in a way that maybe you can't fix in quite so easily.
Yeah, and it's enabling us to see things earlier, so we're catching people at earlier time points. The way it works now in the healthcare system is we're seeing people in a very late stage. It is very hard to do the rescue or limb preservation when you're catching people really towards the end. What happens if we could catch people a little earlier? And even that little earlier, we have a saying in clinical medicine where time is tissue. It gives us more time. And the other analogy I would give is imagine if we were catching every cancer patient at the end stage. I mean, communities would revolt. This is just not acceptable. Why is this okay with like chronic wounds or chronic disease? It's not okay. But we haven't had the technology to be able to assess it regularly until now.
That's a good way to put it. And to continue with the cancer analogy, as somebody who lives in rural Nova Scotia and does everything kind of from a rural standpoint, I see, for example, in my area, a lot of cancer patients who are forced to travel long distances, both for diagnostic issues and for treatment. This fixes that to a degree and enables that technology to be in the hands of people right where they are.
It'll give like primary care or people within the community more information. And I think, there's still going to be travel. The reality is if you need a vascular intervention, you got to come to see the specialist. But what the technology could do is say who needs to go first. Because the one thing we don't understand, unlike cancer, is who needs to be first. So what happens is you get the referral, it's a paper-based fax, and you've got to decide as a specialist, is this a person I need to see now, or can they wait? Like really creating that efficiency in the system means that, yes, you are going to have to travel to see some people who really are very specialized in what they do. But at the same time, you'll know when you need to go and when a follow-up with an image might be okay.
How easily, once MIMOSA becomes very common and easy to access, how easy will it be for any rural doctor to get their hands on it?
Right now, we just were cleared at Health Canada. So we've been in the United States in a commercial period for the last 18 months. So we were cleared at the FDA, actually cleared at the FDA much sooner than Canada. So it's only been the last 3 weeks that we've been cleared. In the early days, certainly the technology is available to Canadian physicians, but right now mainly being sold into academic institutions. So people who are specialists or have wound care clinics. The reality is this product is it does more than the diabetic lower extremity. We look at bed sores or pressure injuries. We look in children. So, what we measure actually happens in little babies. Little babies lose their arms and legs. So 40% of those children die. It's being used in the United States in pediatric ICU, for example. So it has multiple indications and use cases. And so right now the technology is available, but I would say the specialists will probably pick it up first before primary care.
How expensive will it be?
Yeah, so the expense and pricing strategy for the product are still in the works. We weren't expecting Health Canada to come as quickly. We thought it would still be another 6 months. And so we're in negotiations now on what that might look like. And the way it works with a medical device is it's a little bit more complicated on the procurement side. It's not software, it's not something you can pick up off the shelf. So there's complicated procedures in how this actually enters the healthcare system. Most people actually think it's, you get your Health Canada and then all of a sudden it's available. That's not actually the truth. The biggest hurdle for Canadian innovation is actually through procurement. So, and I think it's an important part for the public to understand, just because you have a regulatory approval, that doesn't mean you have a pathway to sale. It just is the starting point. This is also true in the United States, but in certain circumstances, it's a little easier to commercialize in the United States than in Canada.
So how difficult is it? That's really interesting. Like in Canada, is it about red tape? Is it about going through regulatory processes? What slows down that process?
Yeah, so it's really the procurement process, and every system has a different pathway to procurement. And what does procurement mean? It means the contract. So there's a legal department, an IT department, there's a procurement department, there's a vendor that has to sell for you. You need a third party, so you need to get on board with them. They have to negotiate for you. So it can become quite complicated very quickly. To that end, there are organizations in Canada that are trying to expedite the process. And I think it's been an important national initiative. They've done great work in the space. So just kudos to, the government for sort of making this happen. But the biggest barrier to Canadian innovation is not regulatory necessarily. It's actually how technology is bought.
Very interesting. Okay, so let's back things up a little bit and talk a little bit about you and kind of the development. So starting with you, you're originally from Newfoundland and Labrador, right?
Yes, so I grew up in St. John's, went to school there, and spent my time in undergrad and med school at Memorial, and then went on to Toronto to finish my plastic surgery residency, as well as a PhD in medical imaging and wound healing.
You really always seem to have a bit of an entrepreneurial outlook on things, or an innovative look on things. It's really interesting because I find that it's a mindset that not everybody necessarily has.
Yeah, I think the academic lab in Toronto was really designed as what we call knowledge translation. Knowledge translation means let's actually create technology or therapeutics that can actually directly impact the patient. So instead of it being really preclinical, a lot of it was clinical work. So, is this valuable to the system? I wouldn't do anything that I didn't think added value. So if I thought, okay, this is interesting, interesting science, someone else can take that on. But for me, it's like, what impact is this going to have to the patient? And if I didn't see the impact right away, I'd say, let's actually do something that we can really transform the system. And then to that end, that's where MIMOSA really, the idea for MIMOSA as well as the development came out of the lab. So this was a university innovation. Again, lots of backstory to how it all occurred, but with the lens of, okay, this is a problem I have in my practice. This is a problem that these patients are facing. Then go to the lab, build something that actually solves it. And I think it's a really different approach to science and also innovation. A lot of times what happens is you find something in the lab and then you look for where's the problem in the healthcare system. Our philosophy is, what's the problem in the healthcare system? Now let's build a solution that makes sense.
Yeah, you work backwards. You start with the problem, which is a very entrepreneurial way to do things. You start with that problem and then kind of try to engineer your way down through that.
Correct.
If you're an entrepreneur, you may want to consider becoming an Ignite resident. Residency at Ignite will give you the resources, mentorship, and space you need to grow your startup or idea. You'll become part of an incredible support network, a community that's dedicated to seeing you succeed. But don't just take my word for it. Book a tour of Ignite and see what we have to offer you. Go to igniteatlantic.com. I know that you have a background in which you have dealt personally with loss when it comes to diabetes. Is it the diabetic side of it that started the thought process, or was it other things? How did that work?
So in Canada, I'm considered to be an opinion leader in wound care. So, diabetes, pressure injuries, wound care, once you have the whole, how do we heal you? So I've been studying for many years, both clinically and in science, why do certain people wound? And why don't they heal? And why do others heal? So really trying to navigate the skin and understand the skin. And, the skin is your first line of defense. If it's breaking down, there's something really wrong in your body. Again, I had this practice where, we're a high volume surgical group, seeing 60 to 100 patients a day, referrals, just a ridiculous amount of referrals, only really 2 or 3 plastic surgeons in the province of Ontario able to manage these patients. Really disjointed healthcare, so home care not talking to the hospital, but mainly the other way. Hospital not talking to home care because home care is trying, and just so busy. And, that connected care part of the system. Again, understanding it from a clinical point of view, seeing the patients myself, my academic experience in the science. But it wasn't until I had my own personal family experience with my grandfather in rural Newfoundland that I truly understood how do patients experience the system. I really thought I had it figured out and I was solving and I was just the best. I'm the best surgeon and I'm the best academic and we're going to make a difference in all these patients' lives. And then my family started with my grandfather having a diabetic lower extremity wound, multiple vascular interventions, amputation, and he passed away, related to that. I think it wasn't until I started to experience the system as a family member, helping my mom, me in Toronto, they're in rural Newfoundland and in the city, that I said, wow, what we're doing and what I've done all this time isn't really helping the system. It's adding to the body of knowledge, but I haven't really made an impact. If you want to make an impact, it has to be really with the patient lens. Like, how do patients experience the system? So we have to create technology and solutions that really enable them to be healthy and well, and at the same time provide technology to the clinicians, that gives them the information they need to make real-time decisions. So that was the genesis behind Mimosa. And so it's almost a multitude of factors that came together to create the technology. And I think all of them are important. And a culmination of the innovation.
Now, you've been working on this for a long time. When did the original idea and the concept come? How long have you been dealing with this?
Yeah, so honestly, it's a long-winded story on how I ended up building things because I'm not an engineer. I have no background in computer science, and it's really a random story of resilience that led me to this path, which may be another podcast about resilience. But it was an unfortunate situation. I was meant to be a hand surgeon. I was doing peripheral nerve research. My supervisor at the time decided he was leaving and going out west. Didn't want to be that far away from my family. And then I had no job. And so what happened is burn surgeon said, well, I have a project. If you can learn how to be an engineer and you can program it and put it together and figure it out, I'll give you a job for 2 years doing your master's. And that's how it all started. And so I said, sure, I need money. Otherwise, I wasn't going to be able to afford my rent in Toronto. Took the job and, here we go. What was created all those years later after the PhD was the Mimosa solution. So it was really self-taught. I'm very fortunate to be mentored by the National Research Council of Canada. And then the rest I learned on my own, and there was no Google at that time. There was a lot of books.
I can imagine. It's easy to come up with a concept, but to turn that concept into something real that actually functions, that's a whole different story. Did you create a team that built that? How did that work?
So the PhD gave me the principles to understand the engineering, the optics, the computer programming. Then, being a staff plastic surgeon, I understood the clinical environment. Bringing that all back into the lab, I don't want to take full credit for this. I have a co-founder who's an absolute genius in engineering, systems design engineering, data science, data imaging. He truly is that triple threat. It was truly he and I together that came up with the MIMOSA solution, but truly he is responsible for the build. And it's a great story if you want to hear it.
I'd love to. Absolutely.
Right. So we had been circling around each other for 10 years, studying the same molecules, just with different types of technology. We have a mutual friend with type 1 diabetes who was diagnosed later in life who said, I think you two should meet. And because he's a scientist and I'm a scientist, and we both thought, no, we know everything we need to know in our space. What's the crossover? But we both said, actually, this is interesting. Let's explore the opportunity. Within 5 minutes of meeting my co-founder, his name is Dr. General Lung, he said, that's interesting. We had 3 or 4 more coffees afterwards. It was at a coffee shop close to the hospital. 3 months later, he'd built the first one on his kitchen table, tested it in my lab, and we had done it. That's just the start of it. And, we took it from 14 feet tall, 200 pounds to something that fit in our pocket.
That's amazing.
In 3 months.
It really is.
It's amazing. And then we tested it over and over again to say what design would work best, if someone drops it, if it goes in a toilet, or, the environmental conditions. We had a lot of testing to do to figure out what the form factor should look like, and that took years.
I can imagine. Is it at that point you decide, okay, we have something real, we need to form a company and worry about all of the other parts of it? How did that all come together?
So we realized that if we were going to be able to get this out of an academic environment, it needed to be a commercial entity. We could move faster as a commercial entity than waiting for research grants to build. And research grants don't cover manufacturing. They won't cover a regulatory clearance. They don't cover reimbursement. They won't help you with procurement. So what they would help us do is really enable the development of the tech, but that's it. So we realized very quickly, neither one of us really thinking we'd ever start a company, especially, I'm a surgeon. Do I need to be a CEO of a company? But I think if we were truly together going to make an impact on the system, we knew that it had to be a commercial entity. So the idea was we can help more people faster if we do it this way. Otherwise, it would probably still be in the lab, right, 30 or 40 years later.
Yeah, and you can't have that. Is innovation difficult in Canada? Are there, places where you can go that'll kind of push you along through that process?
Yeah, I think innovation is actually great in Canada. And we do a great job at being innovative, especially in the early phase. But entrepreneurship or commercialization is where it becomes difficult as a Canadian innovator. That's what I would say. Canadians are responsible for a ton of innovation that goes out into the world, but we're not really good at commercializing or even our own country buying our own technology.
If you had any advice to give someone just starting off, whether it be as a beginning scientist or as a beginning entrepreneur, what would you give them? Or would it be different advice for either?
There's so many pieces of advice, and I've learned so much as the CEO of the company over the last number of years. I really think I've completely changed. I've changed my outlook. Differentiating innovation versus entrepreneurship, they're different. So entrepreneurship is truly being able to bring this technology into the commercial field. It's a different skill set. You have to decide when you start, what do you like most? Do you want to develop the business? Do you want to get this into the hands of other people, or do you want help? So I think it's really part A or part B. Do you want to hand it off and give it to the business entities and let them run, and you're advising on the path forward? Or B, I want to run the company. I want to bring it to the next level. I like the business. And there's probably something in the middle. But just take your time. Make sure you protect yourself. with that intellectual property. You don't have to publish everything right away. Get it protected first before you put it out there into the mainstream. With such a push as an academic, publish. We kept a lot back in the early period to make sure our IP was granted before we made it public knowledge on what we could do. So it's hard because you're under a lot of pressure as an academic to publish. It's publish or perish. So stick to your guns and protect it first.
Okay, and IP being, for those who don't understand, that's intellectual property. That's not an easy landscape to negotiate through either, is it? It can be fairly difficult or complicated.
And this is where you got to have a good lawyer and a good law firm that's niche in your area. It is usually something, sometimes the universities will help pay for it. Depends on your agreement and where you work. Or you have to pay for it yourself. So it can get quite expensive quite quickly. There are programs, again, across Canada and different provinces that will help offset the cost of IP, but it depends on what you're doing.
You are a person who does a lot of different things. You're a surgeon. You're now an entrepreneur. You're a surfer and a mom. And how do you balance all of this? There's a lot of time that's being eaten up by your professional life. Tell us a little bit about work-life balance.
Yeah, if you speak to my family, they say I have none. I work at, I like multiple balls in the air all the time. I like juggling. If it's not busy, I'm bored. So, it is a bit of my personality. People might say that's a type A personality, but I think it's just a personality that likes a lot of moving parts. I enjoy the problem solving, and I know when to take a break. So I know when it's time to take a break. But if you really, and I'm also a single mom, so it's just myself and my son. My parents do live with me. I actually couldn't do any of this without them. So I travel almost every week. They take care of my son while I'm traveling. I live next to my brother and my sister-in-law, their family. They help me quite a bit. I think in order to do this really properly and to feel balanced while you're doing it, you have to have the support of your family or a community. And that's really why I moved back to Nova Scotia from Toronto, was to surround myself and give my son a different perspective on what it is to live within a community and how you participate within a community. So if my parents listen to this, big, deep gratitude to them. And I think the best thing also about my parents is they've realized who I was at a very early age, and that if I set my mind to do something, I was probably going to go there. They best to support me in the process. So I'm very fortunate that I have extremely supportive parents that just always believed in something, that I could do something different.
Dr. Cross, cheers to the future. Thank you so much for this. This is something that, as a diabetic myself, I see this being life-changing in its potential. So what you're doing is so special, and it's really appreciated.
Thank you for helping us spread the word.
To find out more about MIMOSA Diagnostics, visit their website, mimosadiagnostics.com, and follow them on LinkedIn. You can follow Dr. Cross on LinkedIn as well. To find out more about rural innovation and what Ignite does, check out igniteatlantic.com. And you can follow Ignite Atlantic on Facebook, Instagram, and LinkedIn. And hey, follow me on LinkedIn as well. I'd love to hear from you too. If you enjoyed this episode, we'd love it if you subscribed to Ignited, shared us with your friends, gave us a good review. And remember, you can find past episodes anytime by looking over our archive wherever you download your pods. Any comments or suggestions about the podcast or who you'd like to hear on it, maybe that's you, are most welcome. Just send me an email, Wade, W-A-D-E, @igniteatlantic.com. I'm Wade Cleveland. Thanks for listening. Talk soon.